Hello everybody. For those that are suffering from fluoroquinolone toxicity, which is also known as being floxed, which is also known as suffering from the adverse effects of a fluoroquinolone antibiotic, know the struggles of going to the doctor when you first get floxed. Your world is falling apart, you're sick, and every time you go to the doctors, all of your tests are normal. Well, I was looking over some documentation from the FDA, where they had an advisory meeting in 2015 regarding label changes due to the disabling side effects of fluoroquinolone antibiotics. This is also when the FDA coined the term fluoroquinolone-associated disability, FQAD. Here is what they say about FQAD. This review was done to try to characterize the constellation of disabling symptoms that was seen in the previous review, which we will refer to as fluoroquinolone-associated disability, or FQAD. We are defining disability as a substantial disruption of a person's ability to conduct normal life functions. The person must have adverse events reported from two or more of the following body systems: musculoskeletal, neuropsychiatric, peripheral nervous system, senses, meaning vision, hearing, etc., skin, and cardiovascular. And the adverse events had to last 30 days or longer after stopping the fluoroquinolone. So for people out there that say the fluoroquinolone is no longer in your body, they define the FQAD population as such. The person had to be reported to be previously healthy before taking an oral fluoroquinolone antibiotic. They had to be treated for uncomplicated sinusitis, bronchitis, and a urinary tract infection, UTI. A healthy patient was a person able to perform all of the usual activities of daily living without significant restrictions prior to taking the fluoroquinolone. And here is how the FDA ties this all together. Case report: a 49-year-old woman in 2004. This patient received a 10-day supply of levofloxacin, 500 milligrams, to treat a sinus infection. The symptom began 2 days after starting the drug. Prior to taking this drug, I was a healthy 49-year-old, an advanced downhill skier with no medical problems. I could barely walk, had to crawl up my staircase, had severe muscle weakness, muscle burning, and joint pain in all my limbs. I ached and burned in what seemed every tendon and muscle in my body. I continued to suffer 22 months later with the following disabling conditions: severe tendon, muscle pain and tightness, tendinitis, tingling, numbness, prickling, pins and needles, sensations in my extremities, along with electrical sensations, feeling of worms crawling under my skin, severe arm and leg weakness, muscle twitching, spasms and contractions, severe muscle tenderness. To poke my muscle feels like a bee sting. Inability to sleep due to pain 24 hours per day, 7 days per week. Inability to work due to pain and weakness. Difficulty thinking clearly and confusion. Chronic fatigue. Now, what the FDA found was this: no one specific fluoroquinolone appeared to have a greater association with FQAD than another. The current box warning states that tendinitis and tendon rupture can occur in all ages, but that there is an increased risk in older patients, usually over 60 years of age. In this case series, only 17% of all patients were found to be 60 years of age or older. In addition, the percentage of tendinitis and tendon rupture cases were the same in both younger and older age groups. 74% of the cases reported were in patients 30 to 59 years old. Now here's the important part. Many of the patients' clinicians were reported to be at a loss as to what was causing these symptoms. Some patients reported extensive medical testing to try to diagnose the cause of their disability symptoms, but test results were frequently negative, and effective treatments were not identified. Lastly, the decrease in quality of life was described as being profound, and it affected both the patient and his or her family. I know this doesn't fix anything when we go to the doctors and our tests are normal, but the point of this video is showing that even the FDA acknowledges that FQAD patients that are suffering from fluoroquinolone toxicity and are floxed have normal tests. That's all I got. Thanks, everybody.